Hey everyone, and welcome back for another deep dive. Today we're going on a journey to the heart.
The heart.
Yeah, we'll be exploring the world of heart disease, both the kind you're born with and the kind that develops over time. We're using a college-level pathophysiology document as our guide.
Wow. Using that as a source, are we going to get super technical?
Well, we'll try to keep things understandable. Our goal is to really give everyone listening a good grasp of all the different types of heart disease out there, like what causes them,
hmm
how they're diagnosed, the whole nine yards.
The treatments?
Yeah, the treatments. I was going through this document and I found some pretty surprising things, so hopefully you will too.
I bet.
All right, so let's start with congenital heart disease, which is basically an abnormality in the heart's structure or function that's present from like the moment a baby's born.
Right.
So these abnormalities can be like, a little thing,
hmm
or they can be really severe, even requiring surgery or a heart transplant.
Wow, that's intense. Like in a tiny baby.
Yeah. It's amazing what they can do these days. So I'm curious, like, what causes these abnormalities to develop in the first place?
It could be a bunch of things, actually.
Hmm.
It's often a combination of genetics.
Okay.
So maybe a specific gene mutation or an inherited condition.
Got it.
But things during pregnancy can also have an effect.
Okay.
Like if the mother has diabetes,
Oh.
or consumes alcohol, or has certain viral infections during pregnancy.
That makes sense. So it's not always just one thing. It's
Mm.
kind of a mix.
Yeah, it's a mix.
So how do doctors even detect these abnormalities in a newborn? Like, I'm thinking babies are so small, right?
Right?
Are there any, telltale signs that doctors look for?
Yeah. So doctors look for things like swelling in the scalp,
Okay.
or the abdomen, fluid buildup around the heart, or even decreased fetal movements while the baby's still in the womb.
Oh, wow.
And babies with congenital heart defects, they're also often born prematurely or with a low birth weight.
That's interesting. It seems like early detection is super important.
Absolutely.
So what tools do doctors actually use to diagnose these conditions before birth?
So the gold standard is fetal echocardiography,
Okay.
which is kind of like an ultrasound, but specifically for the heart.
Gotcha.
So they can see the structure and function of the heart
Wow.
in detail before the baby's born.
Hmm.
So that's really useful for especially high-risk pregnancies.
Yeah, so they can be prepared. That technology is amazing.
It is.
So we've got the basic idea of congenital heart disease, but let's dive into the actual defects that babies can be born with,
Sure.
'Cause there's a whole range, right?
Yeah, there's a wide range. Some of them, as we said, might even resolve on their own,
Okay.
and some of them are more complex. So let's start with some less severe ones. Have you ever heard of atrial septal defects?
Atrial septal defects. Is that those holes in the heart they talk about sometimes?
It is, yeah.
Okay, okay.
I've heard of that, yeah.
Yeah.
It's basically an opening in the wall, or the septum, that divides the two upper chambers of the heart,
Okay.
called the atria.
The atria, all right. So what happens with that?
Well, most of those ASDs actually close on their own during infancy
Oh, okay.
or early childhood, but there's another type of hole called a patent foramen oval, or PFO.
A PFO.
Yeah.
And that one's a little trickier.
It can be a bit trickier, yeah.
Okay.
So a PFO is actually a normal part of a baby's circulation in the womb
Okay.
because it lets blood kind of bypass the lungs since the baby's getting oxygen from the mom's placenta.
Right.
But it's supposed to close after birth,
Oh, okay.
but sometimes it stays open.
So it's like a leftover from being in the womb.
Right.
Interesting. So what's the problem if it stays open?
A lot of times there are no symptoms,
Okay.
but it can increase the risk of stroke
Stroke. Whoa.
due to something called paradoxical embolism.
Paradoxical embolism. That sounds intense.
So basically, imagine a blood clot forms somewhere in the body,
Okay.
and it, instead of going to the lungs to be filtered out, it sneaks through this hole, the PFO,
Oh, wow.
and ends up in the brain, causing a stroke.
Oh my gosh. So it's like the blood clot's taking a detour
Yes, it's taking a deep
and
breath.
ending up where it's not supposed to be.
Exactly. It's a rare complication,
Okay.
but something to be aware of.
Okay. So we've got holes in the upper chambers. What about the lower chambers, the ventricles?
So those are called ventricular septal defects,
Okay.
VSDs. They're holes between the two lower chambers.
Okay.
And these can be a bit more problematic because they disrupt the heart's pumping efficiency.
So the heart has to work harder.
The heart has to work harder to compensate.
Gotcha.
And this extra workload can lead to something called pulmonary hypertension.
Pulmonary hypertension. What is that?
It's high blood pressure
Okay.
in the arteries of the lungs.
Oh, okay. So it's like the heart's constantly running a marathon
It is, yeah.
just to keep up with its job.
Yeah.
What can doctors do about those VSDs?
It depends.
Okay.
It depends on the size and the location of the VSD
Okay.
and how much it's affecting the heart's function.
Got it.
Sometimes they close on their own,
Okay.
especially the small ones. But larger VSDs often need to be surgically closed, either with a patch or a special device inserted through a catheter.
It's amazing how surgeons can like go in and repair these like tiny structures in the heart.
It really is. And speaking of intricate structures, let's talk about patent ductus arteriosus.
Patent ductus arteriosus. PDA.
The PDA, yeah.
I remember that one. That's the one where there's a blood vessel that's supposed to close after birth?
You got it. So the ductus arteriosus is a blood vessel
Okay.
that's essential during fetal development.
Mm-hmm.
It allows the blood to bypass the lungs, called the baby's getting oxygen from the placenta.
Right, yeah.
But after birth, when the baby starts breathing on their own, that vessel is supposed to close up.
Okay.
And if it doesn't, it's called a PDA.
Now, I've heard that some babies actually need a PDA to survive.
That's true.
How does that work?
So in some complex heart defects, a baby's circulation depends on that PDA
Okay.
to get oxygenated blood to their body. It's called duct-dependent circulation.
Duct dependent.
Yes, it's temporary.
Okay.
And usually these babies need surgery
Got it.
to create a more normal blood flow pathway.
Okay. So in some cases, a PDA is a good thing.
Yes, in some cases it is.
Wow. That's amazing. So if it's not needed, how's a PDA treated?
Sometimes medication can help close it.
Okay.
But if that doesn't work or if it's large, there's a minimally invasive procedure where they can actually close it off with a tiny coil.
Wow. It's amazing what they can do.
It is.
All right, so we've talked about ASDs, PFOs, VSDs, PDAs. Are we ready to move on to the more serious congenital heart defects?
Yes. There are some conditions that are far more challenging. One example is tetralogy of Fallot,
Tetralogy of Fallot.
or TOF.
A TOF, okay.
It's actually a combination of 4 heart defects.
All at once.
Yes. That, together, prevent enough oxygen-rich blood from getting to the body.
That sounds really serious.
It is. Babies with TOF often have what are known as TET spells.
TET spells, what are those?
So imagine a baby
Okay.
suddenly turns blue,
Their skin.
skin, nails, lips after crying or feeding.
Oh, gosh.
It's caused by a drop in the blood oxygen level.
So they're not getting enough oxygen.
Exactly.
That's scary. Why does that happen?
Well, the 4 defects kind of create an obstruction to blood flow to the lungs.
Okay.
And when the baby cries or exerts themselves, it makes it worse.
Oh, so it's like they're literally struggling to get enough oxygen.
Yes, and here's something you might find interesting. Toddlers or older children with TOF will often instinctively squat down when they're short of breath.
They squat.
They do.
What? Why?
It actually helps. Squatting increases the blood flow back to the heart and to the lungs, which relieves their symptoms.
So the body kind of figured out
It figures out a
the
way
way to get more oxygen.
to improve oxygenation.
That's incredible. But obviously they still need surgery to correct the defects.
They do.
When is that usually done?
Usually during the first year of life.
Wow, it's amazing. Our bodies are really smart in how they adapt.
They are.
But thankfully we have treatments available even for these really complex conditions. So what other serious congenital heart defects are there?
Another one that's worth mentioning is coarctation of the aorta.
Coarctation.
So it's a narrowing of the aorta,
Okay.
which is the main artery carrying oxygen-rich blood from the heart to the body.
Okay, so it's being restricted.
Yes, it restricts blood flow, and it can cause a big difference in blood pressure
Oh.
between the upper and lower body.
So if you took someone's blood pressure on their arm and then on their leg,
There'd be a difference.
there'd be a difference. Wow, okay.
And coarctation of the aorta needs treatment, either surgery or a procedure called balloon dilation with stent placement to widen that narrowed section.
It's amazing, how many different ways they can address these heart defects.
It's pretty incredible.
So we've covered ASDs, PFOs, VSDs, PDA, TOF, coarctation of the aorta. Are there even more congenital heart defects?
There are, but some are really complex.
Okay.
So we'll just touch on them briefly.
Right?
Things like hypoplastic left heart syndrome,
Hypoplast.
tricuspid atresia, pulmonary atresia, Truncus
These
arteriosus.
are all like tongue twisters.
They are.
What was the last one?
Transposition of the great arteries.
Okay, so these all involve like serious malformations.
Severe malformations of the heart structure.
I can only imagine how challenging they are to treat.
Yeah, they often require multiple surgeries.
Wow.
Or even a heart transplant.
Wow.
For example, hypoplastic left heart syndrome, HLHS, usually involves a series of 3 complex surgeries to kind of reroute the blood flow in the heart.
It's like they're re-engineering the heart's plumbing.
They are. That's pretty amazing.
That's wild. It makes you realize like how crucial early detection and intervention is for any heart defect.
Absolutely. And that brings us to a very serious condition called Eisenmenger syndrome,
Eisenmenger syndrome. Okay.
which can develop if those defects, like those holes in the heart we talked about earlier, aren't addressed.
Oh, right. So like the ASDs and the VSDs.
Exactly.
Okay.
So if they're not addressed, they can eventually lead to a condition called pulmonary hypertension.
Pulmonary hypertension, that's where the blood pressure in the lungs
It's really high.
gets super high. Okay. So it's like the pressure builds up over time because of all the extra blood going through the holes.
Right. And as it worsens, the pulmonary hypertension, it can actually cause the blood flow in the heart to reverse direction,
Reverse. Wow. Okay.
leading to lack of oxygen in the blood and cyanosis.
Cyanosis.
Yeah, a bluish discoloration of the skin.
That sounds really serious.
It's a very serious condition.
Okay, so what happens to people with Eisenmenger syndrome?
It can lead to heart failure and even death. So that's why it's, so important to catch and treat these heart defects early.
It's like a domino effect. If you don't fix that one thing,
Yes.
it can lead to all these other problems.
It can.
Okay, so we've talked about a lot of congenital heart defects. What if someone isn't diagnosed early on? Can they still live a normal life?
It really depends on the defect and how severe it is.
Okay.
Some people may not have symptoms till adulthood,
Oh, wow.
while others might have challenges their whole life.
Okay.
But with the right management, a lot of people with congenital heart defects can live very fulfilling lives.
That's good to hear. All right, so we spent a lot of time on congenital heart defects, but what about heart diseases that we develop as we get older?
That's a whole other category called acquired heart disease.
Acquired.
And that's what we'll talk about next.
Okay, so we're moving on to part 2 of our heart journey. Getting pretty deep here, but it's so important to understand what's going on with our hearts.
It is. The more we understand, the better we can take care of ourselves and our families.
Absolutely. Stay tuned, everyone. We'll be right back. All right, so we're back and ready to explore acquired heart diseases, the ones that develop over time.
Right. And we often think about, the arteries, but what about the heart muscle itself? Like when that gets sick.
Oh, okay. Good point. What are we talking about there?
Cardiomyopathies.
Cardiomyopathies.
Yeah, big word, but it essentially means a disease of the heart muscle.
Oh, okay. So not the plumbing,
It's the engine itself.
the engine itself.
Okay.
Gotcha. And there are like different types.
There are different types, yeah.
Okay.
Each one affects the heart's ability to pump blood in a unique way.
Okay, I'm intrigued. Let's break it down. What's the first type?
So the first one is called dilated cardiomyopathy.
Dilated.
In this condition, the heart muscle, especially left ventricle, becomes weakened and enlarged.
Enlarged, so it like stretches out.
It stretches out and it loses its pumping power.
So it's like a rubber band that's been stretched out too much.
Exactly. A great analogy.
And it can't like snap back.
Can't snap back.
Okay, so what causes the heart muscle to like stretch out and weaken like that?
Well, the causes can be varied. It can be genetic,
Okay.
runs in families,
Mm-hmm.
but it can also be acquired due to things like coronary artery disease, viral infections,
Uh-huh.
alcohol abuse,
Okay.
exposure to certain toxins, and even some medications.
Sure.
Sometimes we just don't know.
It's a mystery.
Yeah.
So what kind of symptoms do people have with dilated cardiomyopathy?
Early symptoms can be subtle.
Okay.
Things like shortness of breath, fatigue,
Mm-hmm.
swelling in the legs and feet.
Mhm.
Sometimes people notice an irregular heartbeat.
Oh, okay.
But as it progresses, it can lead to heart failure.
Heart failure, so the heart just can't keep up.
Can't keep up with the demands.
Wow. Okay. That sounds pretty serious. What can you do to treat it?
Treatment focuses on managing those symptoms,
Okay.
slowing the progression,
Yeah.
and preventing complications. So often this involves medications to help the heart pump better,
Yeah.
regulate the heart rhythm, and reduce fluid buildup.
Mm-hmm.
And in some cases, a pacemaker or an implantable defibrillator might be necessary.
Okay.
And then very severe cases, a heart transplant might be the only option.
So a whole spectrum, depending on how severe it is. Okay, so that's dilated cardiomyopathy. What's the next type?
The next type is restrictive cardiomyopathy.
Restrictive.
Less common, but just as serious. So in
Okay.
this one, the heart muscle becomes stiff and rigid.
Stiff. So instead of being stretched out, it's tight.
It's tight. Yeah, it makes it hard for the ventricles to fill with blood.
So it's almost like it can't expand.
Can't expand, yeah.
Okay, what causes that to happen?
It can be caused by a buildup of scar tissue in the heart muscle
Okay.
or an accumulation of abnormal proteins,
Oh, wow.
or even diseases that affect other organs. And sometimes we just don't know the cause.
It's another mystery. So what happens? What are the symptoms?
Because the ventricles can't fill properly, less blood is pumped out to the body.
Okay.
So this can lead to fatigue, shortness of breath, fluid buildup.
Okay, and how do they treat restrictive cardiomyopathy?
Unfortunately, there's no cure.
Oh, okay.
Treatment is really just managing symptoms and improving quality of life.
Okay.
So this might involve medications to reduce the fluid buildup,
Mm-hmm.
regulate heart rhythm, and prevent blood clots.
Okay.
And again, sometimes a heart transplant might be necessary.
Okay. So, 2 down, 1 to go. What's the last type of cardiomyopathy?
The last type is hypertrophic cardiomyopathy, or HCM.
HCM.
It's actually the most common inherited heart condition,
Oh, wow. Okay.
affecting about 1 in 500 people.
Wow. HCM, that sounds familiar. Wasn't there an athlete, like a famous athlete that had that?
Yes, there have been cases of athletes with HCM who have, sudden cardiac arrest
Right, right.
during strenuous
Yeah,
activity.
it's a serious condition. So with HCM, what's happening with the heart muscle?
So the heart muscle, especially the wall between the ventricles, becomes abnormally thick.
Thick. Okay.
And this thickening can actually obstruct blood flow
Oh, okay.
out of the left ventricle.
So it's like bulking up,
It's bulking up.
but it's actually restricting blood flow.
It is, yeah. And this can lead to things like shortness of breath, chest pain, fatigue, dizziness, and even fainting,
Okay.
especially during exercise.
What if someone has a family history of HCM? Should they be worried?
It's definitely worth talking to their doctor about it.
Okay.
Genetic testing can actually identify people who are at risk.
Gotcha.
So that allows for early monitoring and management.
Okay. And what about treatment? What can they do for HCM?
So treatment depends on how bad the symptoms are.
Okay.
And if there are any complications, medications can help relax the heart muscle,
Okay.
slow the heart rate,
Mm-hmm.
and prevent arrhythmias. Sometimes procedures are needed to, actually reduce the thickness of the heart muscle or to implant devices to regulate the heart rhythm.
Mm-hmm.
And in severe cases, a heart transplant may be an option.
Wow. Okay. So we've explored all the cardiomyopathies where, the heart muscle is the problem. Are there other conditions that can affect the heart's ability to work properly?
There are, yes.
Yeah.
Remember those 4 heart valves we talked about?
Oh, right.
Those gatekeepers?
Yeah, that control blood flow through the heart.
They can develop problems over time, too.
Oh, okay. So, they might not be working as smoothly as they should.
Right. We call them valve dysfunction.
Valve dysfunctions. What kind of problems are we talking about?
There are 3 main types: stenosis, regurgitation, and prolapse.
Stenosis, regurgitation, prolapse. Okay, break it down for me.
Sure. Stenosis is when a valve becomes narrowed or stiff,
Okay.
so it's harder for blood to flow through.
So it's like a door that's stuck.
Yes, a stuck door.
Okay, I got that one. What about regurgitation?
Regurgitation is when a valve doesn't close tightly,
Okay.
and it allows blood to leak backwards.
So it's like a leaky faucet.
Yes, like a leaky faucet or a door that doesn't latch properly.
Oh, okay. And then prolapse, the last one.
Prolapse is when the leaflets of a valve bulge or flop backwards,
Oh, okay.
like a door that swings the wrong way.
Okay. So can that happen to any of the valves?
It can happen to any of the 4,
Okay.
but the aortic and mitral valves are the usual suspects.
And remind me, what do those valves do again?
So the aortic valve controls blood flow from the left ventricle to the aorta,
Okay.
which is the main artery that supplies blood to the body.
Okay.
The mitral valve regulates blood flow between the left atrium and the left ventricle.
Okay, so problems with those valves could really mess things up.
It can, yeah.
So what causes these valve problems in the first place?
Well, sometimes it's just wear and tear.
Okay.
As we age, our valves can become calcified or thickened, like our joints.
Hmm.
But other times, it's due to an underlying condition, like rheumatic fever,
Hmm.
which can scar the valves.
Gotcha.
And of course, high blood pressure and heart attacks can damage the valves too.
Yeah, it's like a reminder that our hearts are always working and
Yes.
they're under a lot of stress over our lifetime. What can you do to fix these valve problems? Is it a big deal?
So treatment really depends on how serious the problem is
Okay,
and which valve is involved.
gotcha.
Medications can help manage symptoms and slow the progression, but in a lot of cases, surgery is needed to repair or replace the damaged valve.
Valve replacement. That sounds like a big surgery.
Can be, yeah,
Wow.
but it's often life-saving. And there are two main types of replacement valves.
Okay.
Mechanical valves, which are really durable but require lifelong blood thinners to prevent clots,
Oh,
and bioprosthetic valves made from animal tissue or a human donor.
wow.
They don't require blood thinners, but they don't last as long.
So it's a trade-off. Okay. So it's amazing how like medicine has advanced to have all these different options, but I'm guessing there's more, right? More acquired heart diseases.
You're right, there's more. We still need to discuss what we call the inflammatory heart diseases.
Inflammatory heart diseases. That sounds intense.
It can be.
I'm ready. Let's hear it. All right, so inflammatory heart diseases. Laid on me.
Okay, so we're going to be talking about conditions where inflammation, the body's natural way of protecting itself, can actually cause problems in the heart.
Oh, okay.
We'll focus on endocarditis, myocarditis, and pericarditis.
Okay, so 3 itises.
Exactly.
Let's start with endocarditis. What is that?
Endocarditis is an infection of the endocardium.
The endocardium.
It's the inner lining of the heart,
Okay.
including those heart valves, usually caused by bacteria,
Okay.
that enter the bloodstream
Okay.
and latch onto the heart lining, especially in areas where there's already some damage, like on a valve.
So it's like the bacteria find a weak spot
It's
and they just like take over.
right, and this can actually lead to what are called vegetations.
Vegetation.
Yeah, they're these clumps of bacteria, blood clots, and other debris
Ew.
that build up on the valves or the heart lining.
Vegetations, that just doesn't sound good.
No.
What kind of problems can they cause?
Well, they can interfere with how the heart valves work.
Okay.
So leading to those problems we talked about, regurgitation or stenosis.
Right, right.
They can also break off
Oh, no.
and travel through the bloodstream, causing infections in other parts of the body,
Oh, wow.
like the brain.
So it's not even, it can spread.
It can spread.
Oh, gosh. Okay, what are the symptoms of endocarditis?
They can be tricky. They often mimic other conditions,
Okay.
but common ones include fever, chills, fatigue, shortness of breath,
Okay.
and a new or changing heart murmur.
A heart murmur. Okay.
Sometimes even signs of stroke, like weakness or paralysis.
So endocarditis can look like a lot of different things.
It can, yeah.
How do doctors figure out if that's what it is?
So blood cultures
Okay.
are essential to see what bacteria is causing the infection.
Okay.
And a type of echocardiogram called a transesophageal echocardiogram, or T,
A T. What's that?
it gives us a clearer picture of the heart valves
Okay.
and any vegetations that might be there.
Okay. Is that different from a regular echocardiogram?
It is. It's done with a small probe that goes down the esophagus,
Down the esophagus.
which
Okay.
is the tube that connects your mouth to your stomach.
Right.
This way, we can get much closer to the heart
Makes sense.
to get more detailed images.
Okay, so once they figure out it's endocarditis, how do they treat it?
Usually it involves a long course of IV antibiotics,
Okay.
often for several weeks, to kill the bacteria.
Wow, a long time.
Sometimes surgery is needed to repair or replace a damaged valve
Okay.
or to drain any abscesses.
Okay.
The important thing is to catch it early to prevent complications
Yeah.
like heart failure, stroke, even death.
Okay, so endocarditis. Serious stuff.
It is.
What about myocarditis?
So myocarditis is inflammation of the myocardium,
Myocardium.
the heart muscle itself,
Okay.
and it's most often caused by viral infections.
Okay.
But it can also be caused by bacteria, parasites, fungi, certain medications, autoimmune diseases.
Wow. A lot of things. So it's not an infection, it's just inflammation.
Right.
Oh.
And that inflammation weakens the heart muscle.
Okay.
It affects its ability to pump blood.
So it's like the heart muscle is sore and tired.
Yes, like after a hard workout.
Okay. And what kind of symptoms does that cause?
The symptoms can be anything from like mild fatigue and shortness of breath
Okay.
to severe like heart failure, arrhythmias, or even sudden cardiac arrest.
Oh, okay. So how do they diagnose it?
It can be challenging
Okay.
because the symptoms are so similar to other conditions.
Right.
We use blood tests to look for inflammation.
Okay.
Electrocardiograms, EKGs, can show abnormalities in the heart rhythm. Echocardiograms can check how the heart is functioning.
Okay.
And then sometimes we need a myocardial biopsy.
A biopsy.
Yeah, where we take a small sample of heart tissue.
Wow. Okay, so lots of tests to figure it out.
It can be,
So
yes.
the treatment.
Treatment, thankfully, a lot of cases are mild
Okay.
and resolve on their own with just rest and supportive care.
Okay.
But for more severe cases, we might need medication to support the heart function.
Okay.
In rare instances, a heart transplant.
Wow. Okay. So myocarditis is a bit of a wild card then.
It can be.
Okay. And then the last one, pericarditis.
Yes, pericarditis is inflammation of the pericardium.
The pericardium. Okay. Remind me what that is again.
It's the sac that surrounds the heart,
Oh, right.
protects it.
Okay. So what makes that get inflamed?
Lots of things. It could be viruses, bacteria, autoimmune diseases, medications, radiation therapy, even heart surgery.
Wow. Okay.
And sometimes we just don't know. We call it idiopathic.
Okay. So what happens when the pericardium is inflamed?
That inflammation can cause fluid to build up in the space between the layers of the pericardium.
Okay.
It's called pericardial effusion.
So like the heart is surrounded by extra fluid.
Yes.
Does that affect how it pumps?
It can, yeah.
Yeah.
If enough fluid builds up, it can compress the heart, preventing it from filling properly.
Oh, gosh.
And that's called cardiac tamponade.
Cardiac tamponade, that's serious.
That's very serious, yes.
Yeah.
It's an emergency. We have to drain the fluid.
Okay, wow. What are the signs of that? Cardiac tamponade.
So there's 3 classic symptoms: low blood pressure, muffled heart sounds, and distended neck veins.
Okay.
Also chest pain, shortness of breath, rapid heartbeat.
Okay, so it's like a lot of things going wrong at once.
It is.
What about pericarditis? Just the inflammation, what are the symptoms of that?
So usually chest pain,
Okay.
sharp and stabbing,
Okay.
often gets worse with deep breathing or lying down,
Okay.
and it can radiate to the neck, shoulder, or back.
So again, it can look like other things.
It can, yeah. It can mimic a heart attack or pneumonia.
Okay, so how do they know if it's pericarditis?
Well, listening to the heart, we can hear a pericardial rub.
A rub.
Yeah, it's a rubbing sound
Okay.
caused by those inflamed layers rubbing against each other.
Wow. Okay.
EKGs often show changes, and echocardiograms can detect the effusion.
Okay, so they use a few different tools
Yes.
to figure it out. What about treatment for pericarditis?
Usually medications
Okay.
to reduce inflammation and pain.
Okay.
Sometimes stronger anti-inflammatory medications are needed.
Mm-hmm.
And if there's a large effusion or cardiac tamponade, we do a pericardiocentesis to drain the fluid.
Wow, it's amazing how important the pericardium is.
It is.
Even though it seems so simple, it's really crucial to heart health.
It is.
Okay, so we've covered a lot with these inflammatory heart diseases. Where do we go from here?
Let's switch gears and talk about the most common type, atherosclerosis.
Atherosclerosis, okay. And coronary artery disease. Those are the terms we always hear. Break it down for me.
So atherosclerosis
Yeah.
is a process where plaque builds up inside the arteries.
Plaque, like the stuff on your teeth.
Kind of, yeah. It's a buildup of fats, cholesterol, calcium.
So it's like the arteries are getting clogged?
Yes, they get narrower. And that restricts blood flow.
What causes that to happen?
It's complicated.
Okay.
It's a mix of genetics, lifestyle, and just aging.
Mm-hmm.
High blood pressure, high cholesterol, smoking, diabetes, obesity, not being active, eating lots of saturated and trans fats.
So some things we can control and some things we can't.
Right.
Okay, so how does this plaque, how does it actually cause problems in the heart?
So when plaque builds up in the coronary arteries, the ones that feed the heart itself,
yeah.
it's called coronary artery disease, CAD.
CAD.
And as the plaque grows, it narrows those arteries
Okay.
and reduces the oxygen getting to the heart.
So it's like the heart's not getting enough fuel.
Right. And this can cause chest pain called angina, which is often triggered by, exertion or stress.
Okay.
And if a piece of that plaque breaks off, it can cause a blood clot that blocks the artery,
Yeah.
cutting off blood flow to a part of the heart,
A heart attack.
a heart attack, or myocardial infarction.
So how bad a heart attack is depends on how much of the heart is affected.
It does, yes.
What are the warning signs? What should people look out for?
The most common symptom is chest pain,
Okay.
often described as crushing, squeezing, or a feeling of tightness.
Okay.
And the pain may spread to the arms, back, neck, jaw, even the stomach.
Okay.
Other symptoms include shortness of breath, sweating, nausea, vomiting, dizziness, and a feeling of impending doom.
Impending doom. Okay, so chest pain and maybe a feeling that something's really wrong.
Yes,
Is it always chest pain, though?
not always. Women, older adults, and people with diabetes might not have the classic chest pain.
Oh, okay. So any kind of unusual chest discomfort
Pay attention to it.
should be taken seriously.
Absolutely. Time is muscle when it comes to a heart attack.
Okay, so what kind of treatment is there for a heart attack?
So emergency treatment usually involves medications to break up the blood clot
Okay,
and procedures to restore blood flow.
okay,
Things like angioplasty, where they use a tiny balloon to open the blocked artery,
okay,
or stenting, where they put in a small mesh tube
okay.
to keep it open. Sometimes coronary artery bypass surgery is needed,
Bypass surgery.
where we take a healthy blood vessel and create a detour around the blockage.
Wow. Okay. It's amazing that we have these treatments. But it sounds like prevention is really important.
It is, yeah.
So what can people do to, lower the risk of all this?
Healthy lifestyle choices are the best way to prevent heart disease.
Okay.
Eating a healthy diet,
Mm-hmm.
getting regular exercise,
Yeah.
maintaining a healthy weight, managing stress, and not smoking.
The basics.
The basics, but so important.
Well, we've covered so much today.
We have.
From the heart conditions babies are born with to the ones that develop over time.
It's been quite a journey.
It really has. I'm leaving with a whole new understanding of how incredible the heart is.
It is amazing.
And all the amazing medical advances to help people live longer.
It really is. And one final thought. Even if heart disease runs in your family, you can still take control of your health.
That's a good reminder.
Don't underestimate the power of those healthy choices.
Our hearts work so hard for us.
They do.
We've got to take care of them.
Absolutely.
Well, thanks for listening, everyone, to our deep dive into the world of heart disease.
It's been a pleasure.
I'm definitely feeling inspired to make some heart-healthy changes. Until next time, stay curious.